Welcome and thank you all for joining CHIME Innovation today as we have an exciting opportunity to preview two really exciting upcoming innovation summits. The first of which is our Sustainable Innovation Summit taking place May 3rd through 5th on the campus of Baptist Health in Jacksonville, Florida. And the second program, Innovation in Clinical Informatics, taking place June 4th and 5th, which will be co-located with the AI Med Global Summit in San Diego, sunny San Diego. I'm Keith Freidenberg, Chief Operating and Innovation Officer at CHIME, and it's my absolute pleasure to be here with you all. We hope you're anxious to learn a little bit more about these programs. We're certainly excited to tell you a little bit more about what's coming and a great opportunity to preview what's ahead. Before we begin, I would be remiss if I didn't acknowledge and, of course, thank both our summit hosts and a special guest for today, Erin Mary, who's Senior Vice President, Chief Digital and Information Officer at Baptist Health in Jacksonville. Erin, thanks for joining us. Dr. George Reynolds, Executive Advisor for Clinical Informatics for CHIME. George, thank you as well for joining us. And our special guest today, Dr. C.T. Lin, CMIO at University of Colorado Health. Great to have all three of you with us today, and we're excited to get to you here as quickly as possible. I'd also like to acknowledge a new member of the CHIME Innovation team, John Mark Green, who is our new Director of Innovation. John Mark, great to have you here, and thanks for joining us as well. Also want to take a moment just to say thank you to a couple of organizations who helped make all of this happen. They're terrific supporters of CHIME Innovation programs and are specifically sponsoring these two upcoming events. The HCI Group is our title sponsor for the Sustainable Innovation Summit. So thank you to the HCI Group for that tremendous support, as well as our supporting sponsors, eVisit, Remedy Health Solutions, and Gozio Health. And Remedy Health Solutions, again, coming strong as our title sponsor for the Innovation in Clinical Informatics Summit. So again, HCI Group, Remedy, eVisit, Gozio Health, thank you for that tremendous support and partnership. It really helps us to be able to offer programs like these two innovation summits. And these partnerships are really special. We greatly appreciate them. With that, we're now going to shift gears here. We're going to talk a little bit about the first of our two innovation summits. This will be the Sustainable Innovation Summit. What does that mean? We're going to talk about that in a moment. Again, taking place May 3rd through the 5th and on the campus of Baptist Health in their Innovation Center. This is an amazing space. Erin and Baptist Health were gracious enough to host an Innovation Summit a year ago. And what a wonderful opportunity for us to come back. Sustainable Innovation Summit, what is it? It's really designed to bring leaders together, CHIME members together to rally around, frankly, what are some of the toughest challenges that our members are facing today. We've got some really harsh economic realities. If you follow the industry and some of the news out there, you're seeing and hearing this every day. It's a tough economic environment, and it's only getting tougher. We know we've got workforce shortages, and the talent wars are real. We know this for sure. And of course, issues like clinician burnout. These are just a few of the pressures that you all are facing out there. And more importantly, what CHIME members are telling us that they're being asked to do is more with less, right? We're often challenged with that. How can we get a little more efficient, a little more effective? But sustainable innovation, it's not about rocket ship innovation, right? It's about getting a little bit better at everything that we do using innovation processes and systems. So through a series of fishbowl panels or presentations, we love the fishbowl style because it gives everybody a voice in that room. We're going to talk about some of these sustainable innovation opportunities. You're going to hear some things that are happening in CHIME member organizations like Erin's organization at Baptist Health. And we're going to equip you with some strategies and hopefully some tools that you can take back to your own organization and really put those to use. So with that, we're going to go ahead and get started. It's my pleasure again to introduce Erin Mary, Senior Vice President, Chief Digital and Information Officer at Baptist Health. In addition to Erin's challenging day job, he does so much more. He's a member of the CHIME Board of Trustees and again is our gracious host for the Innovation Summit. Erin, we've invited you here to come and talk about maybe some of the pressures that your organization is facing today and how you're leveraging sustainable innovation opportunities to position Baptist Health to meet those challenges head on. So with that, Erin, I'm going to turn things over to you.
Appreciate that so much, Keith, and thank you, and appreciate the fellow panelists, Dr. Lynn, Dr. Reynolds, John Mark. It's always good to see you guys, and of course, Chris Worth there in the corner. So it's good to catch up and talk a little bit about what we're doing at Baptist Health, what is sustainable innovation, and why is this important for us? So as Keith was alluding to, we have an innovation center. So innovation's in our DNA. All right, our board of directors many years ago actually set up an entire investment fund to make sure that we're looking at companies appropriately, pragmatically, partnering with them, investing where we need to invest. We're one of the first members of Truveta, which is a consortium of hospital systems that get together and share their data. We do things very differently here at Baptist. But before I get into the nuts and bolts, let's talk about why this matters, right? Right now is the most challenging time, and it feels like I've been hearing this for years across CHIME, but I really do believe it is the most challenging time to be a CIO or CDIO or CMIO or any of the alphabet soup right now. Why is that? We're on the coming off of, knock on wood, a major pandemic, making sure that we revamp our operations and finances without CARES funding, without all these things going on, and realizing the gap that's there at all of our health systems. This is across the board between what is operationally effective and efficient, what our consumers, aka our patients and our physicians are asking for, and what the technology actually would deliver in the industry. So it's up to us to tether all of that together to find ways to become more efficient and more effective. Now, mind you, that a lot of the healthcare systems being not-for-profit reinvest back into the org, right? Reinvest back into community, reinvest back into sustainable whatever conditions in the environment, whatever it may be. So what we're trying to do is make sure that as our mission states, right, as all these health systems, not-for-profit health systems are, which is to make sure we continue to invest in our people, our processes, the region that we serve or regions, depending how large you are, et cetera, and get about our mission. That's the whole objective of why we're in these roles. So it's up to us to learn from each other, exchange information, ideas, and get to goal. All right. So what does the Sustainable Innovation Summit do for you? Well, first of all, I always say there's no shame in borrowing a good idea, right? So what happened even last year in Jacksonville was a number of CIOs, CDOs, CNIOs, CMIOs, and others got together, started sharing ideas and realizing, hey, we actually resemble each other with our challenges. Let's borrow good ideas. And from that summit sparked a number of regional activities with folks getting together, sharing ideas, talking about things. We had exchange information sessions with Nemours and others for this region. It was excellent. And it was an excellent way to, number one, simply meet your counterparts and share good ideas. Number two thing is the fact that the forum and concept is not like coming to a trade show and I'm talking to you. You actually participate, right? You get up there on stage, you can get up at will to be able to comment or add questions or ask questions, whatever you need to do. And so it's an engagement aspect that pulls it out of you, the creative juices to figure out the right way to skin a cat. Now, remember this, there is no right answer to some of these complex solutions. There is an answer for your region. There's an answer for Baptist Jacksonville. There is an answer for whatever health system, but somewhere in the middle lies what's good for you. And so the great thing here is you get perspective of, nationally, and here you got San Diego and Jacksonville, so you're getting two flavors there. But the reality is you're getting a flavor for what's going on across the country. And you're having CIOs say, we're seeing this in our region. We're seeing this in our area. Well, guess what? Florida is growing. About 1,000 people a day, about 100 people a day move to northern Florida. So I'm going to be on the receiving end of some of those established challenges and say, I don't know, some north state like Massachusetts or New York where it's too cold and everybody wants to move here to Florida. So might as well get ahead of that now and start understanding what could be down the road that you need to be thinking of, right? Population demographic changes, things that you need to think about for social determinants of health. All these questions and issues that are out there that are now complicating Florida and this region. Great, get ahead of that. It's also our job as a CIO or CDIO to be a bit of a fortune teller, right? You are the air traffic control for your boards of directors and for your C-suite. You are the one expected to be able to tell them, hey, did you know that this wonky CMS regulation is coming out and this is what it can do to us? Or this is what information blocking really means to you. You also get a sense of policy at these conferences to understand what should we be thinking about. For me personally, as co-chair of the HITAC, in addition to all the other things I do, that's important because it allows me to take back to DC and others and say, guess what? The top leading CIOs and CDIOs across the country don't have a clue what this actually means, nor do they know what to do with it. We need to refine this rulemaking or whatever to actually make sense. So you have a chance to influence. So when you add all that together, right, at a health system like Baptist, which is innovative at its core, you really have a melting pot of folks come together and be able to say, hey, this is what we need to do. Okay, so let's go into some fun ideations I'm going to share with you here that we've done here that I'll be talking about at the Sustainable Innovation Conference. Number one, we've rolled out an entire innovation program called Baptist Invite. Baptist Invite allows you to come into the fold with any idea that you have from the front line and being able to say, hey, I have this idea, I have this notion, how do we do it? This allows my frontline staff, nurses, soon to be physicians, we haven't rolled out to the medical staff yet, that's coming, to be able to bring up any innovative idea, and it goes into an ideation camp, basically, where a group of multidisciplinary leaders, clinicians, others look at it and go, do we want to fund this, or do we want to explore it? That does not mean go buy a new toy. That does not mean go buy a new tech. That could mean, hey, we should change out our linens for a different manufacturer. That could mean, hey, this workflow for doing clean gel in, gel out, clean hand washing could be done differently and more effective. It could mean, hey, if you have this different type of telemedicine service for the same vendor, same money, we actually get better value or savings. Okay, those are great ideas. That's innovative. That's sustainable. That's not, I'm going to go spend more additive dollars on top of what my current spend is for IT. That's how do I use, I call it house money, more effective, more efficient, and or find ways to save, especially in the non-labor domains. Okay, so we have that program rolled out. Second thing, we are looking at ways for our clinicians, especially our nurses, to work top of license. What does that mean? It means using things like robotics, drone delivery, automation, advanced ML algorithms to be able to assist the caregivers at the point of care and alleviate them from burdens and programs that they need to do. Example, we're the first health system in Florida to go live with Moxie robots. We've been live now about over 8 months or so. The ROI has been tremendous in that partnership and that purchase acquisition with them. We have saved over 5,000 hours manual labor, hard ROI already, and been able to reduce some of the staffing models that we would have had to have because we're leveraging robotics. The next generation of it will have it fully integrated with our electronic medical record and so forth and so on. But even today, as it stands, the ROI has been tremendous. So how do you look at things like automation, robotics, ML, some fancy, I don't want to use the word BPAs because Dr. Lin will just throw something at me through the screen, but how do we do prompting in the right way? I know, in the right way, to make sure that our clinicians are doing the right thing, the right place at the right time. That's the whole concept here. And I would say last but not least, Keith, is that you alluded to it earlier, that the workforce challenges of today are very different than the workforce challenges of yesterday. One of the other side things I do, it's fun, is I teach CHIME University. So I get a chance to look at a lot of the upcoming talent in health IT, and these students ask great questions. They really want to make a difference. So it's not all about, hey, what's my salary? Yeah, that's important. But it's how do I make a difference in a meaningful way? How do I use technology and digital in a meaningful way? And from my perspective, that is so important because if I'm going to try to recruit the workforce of the future, I have to look at that. So all that coming together is exactly what sustainable innovation is about.
Awesome, Aaron. Thank you so much. And if what Aaron just shared with you there sort of resonates with what's going on in your own organizations, and I have to believe it does, we certainly hope you'll consider joining us in May on the campus of Baptist Health. So thanks again, Aaron, for that. I love the Baptist Invite idea because we're frequently asked, how do you create that culture of innovation that really inspires across the organization, across the enterprise, people to be more innovative and look for those opportunities? And that's one that probably costs you nothing at Baptist Health, Baptist Invite, to capture some of those ideas. So thank you again. With that, I'd actually like to turn things over to CHIME's Director of Innovation, John Mark Green, and he's going to talk a little bit about our June program, Innovation in Clinical Informatics. John Mark, over to you.
Thank you, Keith. I really appreciate it. I'm very honored to preview our next great event. The second of our upcoming innovation programs will take place in person June 4th and 5th, co-located with the AI Med Global Summit This is sunny San Diego, and we want to thank you to AI Med for the opportunity to collaborate and to Dr. George Reynolds for developing and hosting this program. So innovation in clinical informatics is designed to bring thought leaders together who are developing best practices and innovative solutions to advance digital healthcare in the area of clinical informatics. As we mentioned, the summit's a collaboration with AI Med and will happen in conjunction with the AI Med Global Summit 2023. The program is included with their registration fee. Now, similar to the May Summit, we use fishbowl panels because we want to allow everyone to have a voice in the room. Okay, let's get started. It's my pleasure now to introduce Dr. George Reynolds, the Executive Advisor for Clinical Informatics with CHIME and retired CIO and CMIO from Omaha Children's Hospital and Health Center, and Dr. C.T. Lin, CMIO at UC Health and Professor of Medicine at the University of Colorado and board certified in internal medicine and clinical informatics. So about a year ago, George approached us with the idea to develop an innovation program focusing on the unique needs and challenges of the clinical informatics community. And we are thrilled to have him leading this program. George and CT are here to share some of the pressures they're hearing about from the clinical informatics community and how innovation strategies and frameworks are helping organizations provide better service and care to their communities while alleviating pressures from clinicians. So welcome again, and we'll turn things over to you both.
Thanks, John Mark. And thank you, Aaron, for that really high-powered and excellent description of the program in Jacksonville. Our program is very similar in its approach and its motives. The difference, obviously, is all of our speakers are physicians and nurses, And when you think about, what business are we in? We're not in the IT business, we're in the healthcare business. And so this idea that we're focusing on the needs of the clinicians and our patients. So our focus in the agenda is patient engagement. It's innovations in the inpatient space, it's innovations in the ambulatory space, and it's what can we do differently to bring joy back into healthcare and reduce burnout, which is a critical issue, not just for physicians, but certainly for nurses as well. And so those are the key things we focus on in the program. I pulled it up so I wouldn't forget anybody because we have a fabulous faculty. In addition to Dr. Lin, we've got Chris Longhurst and Amy Siddipati from UC San Diego. We've got Lisa Grissom and Natalie Pagler from Stanford Children's. We've got Teresa Meadows from Cook Children's in Fort Worth. We've got Liz Johnson, former CHIME board chair and nursing spokesperson. Bill Feaster from Children's of Orange County. Cindy Koobs from Children's in San Diego. So we've got a tremendous panel. And again, we're going to be using these fishbowl panels. So it's a great opportunity. We get 3 people up there, and then people from the audience come on up. We did this in San Antonio right before the CHIME Fall Forum, and and we thought, well, we're going to get maybe 30, 40, 50 clinically oriented people. We got well over 100 people, and half of them were not clinical people, and they were there to learn and hear the concerns of clinical people. So this isn't just a program that's serving the needs of the clinical informatics community. It's really the idea that we're engaging with our CIO partners and other perhaps more technically oriented people to have that dialogue and that conversation. Now, the thing that will be different this time than in San Antonio is, as John Mark mentioned and Keith mentioned, we're doing this in conjunction with AI Med. This is the first time CHIME has done a program with AI Med. And when Keith came to me with the idea several months ago, it was like, well, I don't know much about AI Med, but it sounds interesting and it sounds certainly relevant from an innovation standpoint. And that was kind of before this whole ChatGPT thing has blown up. So it's now, I think, the format works the same no matter where you do it, but the questions we ask and the conversations we have, I think, are going to be different this time around. CT, you were on the last one, and you know what's coming with this one, and you are our keynote speaker for the first day of this 2-day program at AI Med. What do you think? How's it going to go differently than it did in San Antonio just last November?
Thanks, George. I'm really looking forward to this. First of all, the fishbowl format is innovative and allows the audience voice in a unique way. We found that when we have panelists talking and then audience members just asking questions, that's one layer of discussion, but it really transforms the conversation when the audience member sort of comes up and says, well, this is what we're experiencing. And especially where we have advances moving quickly, like Chat GPT, where every 2 days, every 12 hours, there's something new. I tremendously look forward to the audience, particularly at AI Med, coming up and saying, this is what we're working on, this is what we're discovering, and having a much broader conversation and taking the conversation in sort of unanticipated directions. So I'm really thinking that the audience at AI Med might be actually the perfect meld for our clinicians to talk about. Well, sure, we have technologists who are doing some really cool, fast-moving stuff, and then we have clinicians where there's an 80-20 rule in healthcare project success, and I'll leave it to you to determine which is 80 and 20 between technology development and social skills deployment of successful projects. And that's a fun conversation that sometimes we don't fully appreciate. And so having both groups in the room to have that debate, I think, can be pretty powerful.
Yeah, and yeah, you bring up a really excellent point, which is, okay, so now we have this AI technology. Where does it fit in the workflow? How are we going to use it? How are we going to safely use it? Not just effectively use it, but safely use it. I think these are going to be really important things that we're going to need to figure out. And so I'm really looking forward to getting these people together and having this conversation, because I think these conversations are happening all over the country and probably all over the world. The other thing the one thing, Aaron, that you're not going to have in Jacksonville that we're going to have in San Diego, you know what that is? We're going to have a ukulele player.
Wow.
CT, you want to sing us out?
I would be happy to. Actually have a song that might be somewhat topical. I call this Hospital of the Rising Sun. There is a hospital in Colorado they call the Rising Sun. It's been the ruin of many a poor doc, and God, I know I'm one. At first, we had a tough old time. Pandemic fever on the rise. We were not so sure that we would survive with keyboards and mice to sanitize. But then something changed in the air one night. Those sepsis cases, we had none, with predictive alerts and surveillance teams in the Hospital of the Rising Sun. Well, I got 1 foot in my deep, dark past and 1 foot in the car. I'm going back to Colorado to be an epic star. Well, there is a hospital in Colorado they call the Rising Sun, and it's been the savior of many a poor doc. And God, I know I'm one.
Awesome.
How's that for innovation?
That was pretty amazing. I tell you what, if you aren't excited about joining us in Jacksonville at Baptist Health in May, or in San Diego for the AI Med and Clinical Informatics Innovation Program, I don't know what we have to do to get you excited. Aaron, maybe we should invite CT to come join us in May. Your place,
for our medical staff. That's fantastic.
Absolutely. Thank you very much, CT. I'd like to thank all of our guests today, Aaron, Miri, George Reynolds, Dr. Reynolds, and Dr. C.T. Lin. Thank you all for joining us. Again, John, Mark, and I would like to thank our amazing sponsors, the HCI Group, Remedy Health Solutions, eVisit, and Gozio Health. We really appreciate your tremendous support and allow us to be able to bring programs like this to CHIME and the CHIME community. We really are trying to accelerate bringing innovative solutions to the market. And this is a great way in which we can do that, is by bringing you all together. Again, we look forward to seeing you hopefully in May 3rd through the 5th at the Baptist Health System Innovation Center, and or June 4th and 5th in San Diego, co-located with the AI Med Global event. You can register for both of these programs by visiting chimeinnovation.org. And I think we have this really cool QR code up on the screen here, so you can snap that, take it right to the chimeinnovation.org website. Thank you again to our guests. We look forward to seeing you all in May and in June. Take care, everybody, and be safe out there.